My name's Judy. I'm a dental assisting instructor here at Anderson College. I've been in dentistry for over 35 years, I guess. Went to school in Vancouver, BC, worked there for a few years, moved to Alberta, where Alberta is a regulated province, which means dental assistants can do a lot more duties on their own than they can in Ontario right now. So out there I was an RDA, registered dental assistant. And then in 2002 I moved to Ontario and been working here in Paris, Ontario and in Brantford, Ontario for years, and moved to teaching in I think 2011, started teaching, and then I was teaching and working both together and for about 4 years, and then from there I just have been teaching full-time then until now. The program is to find professionals for the dental field and dental assisting. We're basically dental nurses. We assist the dentists, we help them stay organized. So what we do in the program is not only teach the skills they need to do and the theory behind it, but also how to be a professional in that environment. Patient support is very important, so we really help brush up some professionalism skills, along with teaching them all the skills, all the procedures, the instruments, how to be a good dental assistant, but also beyond that, how to grow kind of as a person, as a professional in the medical dental field, which I think is really important. In order to do the practical skills, you have to learn the why we do it, how we do it, what's involved in doing it. Students need to learn how to communicate with their patients and be successful. So we teach them, all about the instruments and procedures and how to do all the skills. We do half of the day is in the classroom, the other half of the day is here in the clinic. There's a lot of hands-on, so they'll get to do all of these skills and learn all about the sterilization. Infection control obviously is very important. They will learn to take x-rays. So there's a lot of dental materials, equipment. There's 2 different levels. Level 1 is, assisting, sterilizing, seating patients, doing all that. But then there's a level 2, which is beyond that, where they get to do some work in the mouth. So they'll learn to polish, take impressions, make study models. So there's a few different things that in the level 2 that they can do beyond what they learn in level 1. And National Dental Assisting Examination Board, they put out an exam that is done at the end of the program. So when students graduate, they are level 1. And when they graduate, they will become HARP approved on graduation, so they can take x-rays. In order to do all the skills that they learn in level 2, they need to write and pass that national exam. And once they do, they become a level 2, and so they are able to do a lot more things on their own. At the end of level 1, they will go out for a week. At the end of level 2, at the end of the program, they will go out and do the other 3 weeks, so the other 75 hours. And from there, most of them, if not all of them, will get hired. Sometimes they get hired out of their first placement. There's a demand for dental assistants. There has been for a long time. So students really usually don't have a hard time finding a job. By the end of level 1, a lot of the students are already working part-time. And then by the end of level 2, a lot of them come back employed. Dental assisting is a great career. I've been in it for a long time. There are multiple different things you can do in an office. You may not want to be clinical. You can be work front desk if you like greeting patients, sending out their insurance information, billing and all of that. Or you can be a treatment coordinator, talking to your patients about treatments before they go in and get those treatments done. You could work in a dental lab. You can do insurance. You could be a dental sales rep, to go into offices work for a dental sales company. So there's multiple different things you can do in dentistry with the knowledge of the dental assisting program. There is something for everybody. Some people like doing lab. In a dental office, in an ortho office, orthodontics, they can make all the appliances there. So there's multiple different things that people can do, lots of different opportunities, for something for everybody.